So you're going to have a mommy makeover procedure. Maybe you want to look stunning for some upcoming event, and you want to know if you have enough time to be healed up to make that event. In today's video, we will talk about what the recovery time looks like after a mommy makeover. Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon with expertise in breast reconstruction and cosmetic surgery of the breast and body. I make educational videos related to plastic surgery. So first, what is a mommy makeover? A mommy makeover is a procedure that addresses two areas of the body, the abdomen and the breast. For the abdomen, the procedures involved here are chiefly an abdominoplasty or tummy tuck and liposuction. For the breasts, a number of procedures can be performed here. This can be a breast reduction, a breast lift, breast augmentation with implants, or a breast lift with implants. Sometimes fat grafting is added to these procedures just as a nice little touch to give a better cosmetic outcome. In short, a mommy makeover is a tummy tuck with liposuction and one of those breast procedures. So now that we have an understanding of what the surgery entails, let's talk about recovery. For this surgery, most patients are able to go home the same day of surgery. If you have medical issues or you've had high volume liposuction, sometimes this will require you to stay overnight in the hospital or ambulatory surgery area. Immediately after surgery, you'll be groggy. Additionally, you'll have some pain at your surgery sites. Most surgeons use long-lasting numbing medication to help with that pain, and for most of my patients, this pain is very tolerable and easily controlled with by-mouth medications. Some patients experience nausea, and if you have a history of nausea after surgery or get motion sickness easily, you should let your plastic surgeon and anesthesiologist know, because they can use certain medications to help reduce nausea after surgery. Two of the more common medications used would be a scopolamine patch, which is a small patch placed behind the ear to help with postoperative nausea, and sometimes a steroid is also given to help reduce the chances of you feeling ill after surgery. One tip here, if you do have the patch, make sure to avoid touching it and then touching your eyes. This medication can cause your pupils to dilate, much like the medication used when you go to the eye doctor. And if you have that happen, you won't be able to focus correctly, your vision can become blurry, and it can be a bit scary, so don't do that. So what about your post-op dressings? The bandages you have placed during surgery should be removed just before your first shower, 24 hours after surgery. In my practice, I ask patients to shower 24 hours and have the water hit their back and gently drip over the front. Use a mild soap like a baby soap and pat it dry. You want to avoid vigorous rubbing. After you're dry, we have found it useful if patients use a clean white t-shirt cut down the middle and placed on like a vest. This will help keep your incisions protected from the overlying garments, and it will help your garments from getting soiled. If you've had liposuction, particularly higher volume liposuction, you may have drainage at your incision sites. This is normal. The way we do liposuction is we infiltrate the soft tissues with saline as well as other medications. We do this because that helps us break up the fat cells with liposuction, and it helps with pain control as well as blood loss. Most of that fluid is removed with the liposuction. However, some of it remains. Your body does a good job of handling some of it, but some of that fluid will leak out through your incisions. It's usually reddish tinged, and for some patients who aren't made aware of this ahead of time, it can be alarming. If you feel like you're having excessive amounts of fluid, contact your surgeon. If any of my patients have concerns, I want them to let me know about that, so that I can calm their nerves or address any issues if they're having any. So don't hesitate to reach out to your plastic surgeon if you're concerned. Again, this is common, and I tell my patients to manage this with dressing changes, especially for the first 24 hours. It usually subsides after that. Your diet after surgery. It's not necessary to eat for the first 24 hours after surgery. Again, you'll be groggy, maybe your stomach's a little upset, and you may not have the best appetite. That's okay. As long as you're drinking fluids, that's the most important thing. And you don't need to be chugging Gatorades and water, but as long as you're sipping fluids all day and maintaining your hydration, that's what's most important. So how do you know if you're well hydrated? Well, check your urine output. Your urine should be clear colored, and you should be able to make urine every 3 to 5 hours. If you're not meeting those parameters, call your surgeon to ask for guidance. If you're not able to hold down fluids and feel like you're getting dehydrated, you might need to return to the hospital for IV fluid support. This is a rare occurrence, but something you should know about. If you are feeling up to eating, don't eat something too heavy or greasy. Go light. You don't want to upset your stomach. Now, the first few days after surgery, you'll be resting, drinking plenty of fluids, and walking. That's right, walking. Walking is one of the most important things you can do in your recovery process. It increases your circulation, helps with your lung function, decreases chances of getting blood clots, and reduces your anxiety. all positive things. My patients who do this bounce back after surgery. It really works. So what can you do as far as exercises? No heavy lifting, arm exercises, or core exercises for the first 8 weeks after surgery. This is important for 2 reasons. If you had implants placed, those arm movements can displace the implant from the pocket that's maturing. You want that implant to stay in place and not migrate out of pocket. If that happens, your cosmetic result won't look good. For the abdominal area, you likely had a rectus diastasis correction. That's where we use suturing techniques to bring the muscles back to the midline where they belong. If you're doing lots of core exercises, that can disrupt those sutures before those muscles heal. Post-op garments. Post-op garments are extremely important in your recovery. These are the surgical bras and the waist training compression garments that will help to reduce pain, reduce swelling, and give you a better cosmetic result. You want to avoid an underwire bra for the first 8 weeks after surgery. And for the abdominal area, the waist training type of garments like the Fajas brand are great in shaping the waistline and giving good compression where it's needed. When you buy one, go ahead and buy a second one. When you take a shower or you have a soiled garment, you may want to interchange those garments so you have one clean one and one dirty one. And for the abdominal support devices and the bra, you want to wear it 24/7 for the first 6 weeks. You likely had a drain placed if you had a full tummy tuck, and the compression garments will help control that fluid so you get your drain out sooner. Scar care. At 3 weeks, scar care can begin for all closed incisions without any scabbing. This can involve scar cream, taping, or other methods. I prefer the silicone tapes. I like my patients to use this with the addition of massage for the first 6 months after surgery. It takes a scar a full year to fully mature. Initially, when a scar is created, the collagen is laid down in a haphazard fashion. Over the course of a year, those collagen fibers will reorganize and become a faint scar. That's the goal. The massage and the silicone tape or the scar creams help in that remodeling process. One tip here, if you use the silicone tape, you can reuse it. When you take a shower, take it off, stick it on the mirror, and you can make your surgical tape go further. Another adjunct that is used is lymphatic massage. Lymphatic massage is helpful in reducing swelling in areas, especially where liposuction was done or at tummy tuck sites. I like my patients to start this 3 to 4 weeks after surgery. You should go to an experienced physical therapist who has experience doing lymphatic massage after surgery. If you don't have access to a physical therapist, one cheap and easy thing you can use is a lymphatic brush. And what you do is you use this brushing technique to gently rub the skin and will help increase lymphatic flow. This will help reduce swelling and increase circulation. One last thing that we have implemented in our practice is the use of microneedling. This can help the collagen in the scar and with scar maturation. I think it works really great for scars, and for our patients, we recommend they start this 3 to 4 weeks after surgery, once the scar has started to heal. How do you sleep after surgery? After surgery, you should sleep in a reclined position. We usually recommend having patients have several pillows under their back and a couple pillows under their legs. This will help keep tension off your abdominal incision sites. You want to avoid sleeping on your belly or on your side for the first 6 weeks after surgery. No tummy sleeping, at least for the first 3 months. The first few weeks after surgery are the toughest, especially if you have a drain that's been placed. After the 3rd week, about 70% of the swelling is gone. And with reduction in swelling, most of the pain is gone as well. You should feel pretty comfortable at this point. The remaining swelling subsides over the course of 3 months. So when can you go out and impress your friends with your newfound body? Once the drain is out, you should feel comfortable to go out and socialize or have dinner. I would avoid going out for any excessive periods of time because you will feel tired and still need naps frequently. At around the 6-week mark, you should feel pretty comfortable to do most things. As far as showing off your body at the pool, you can lounge, but I would avoid going swimming for the first 6 weeks. And by swimming, I mean getting into a chlorine pool and not doing too much just yet. You want to avoid any oceans, lakes, or rivers. Those waters can be dirty, and you don't want to risk getting an infection, especially with an implant. So when can you return to work? If you have a desk job or can work from home, most patients can return to work at about the 3-week mark. You might feel up to going to work sooner than that, but give yourself the wiggle room. If your job requires any lifting, you really want to avoid doing the lifting for the first 6 weeks. And at that point, you'll have to be cleared by your surgeon to make sure that you're not gonna hurt your recovery process. Again, our concerns here are implant malposition and affecting the rectus diastasis plication that was done at the tummy tuck site. Well, that covers most of the questions that come up about the recovery process after a mommy makeover. We covered a lot of info in this video, and I hope you found it useful. Your specific situation may be different, but you can use this information as a rough guide in your recovery. Comment below for any questions you might have. And if you like this video, please hit like and subscribe to our channel. And don't forget to visit our website where you can learn more about the procedures that I perform. Thanks for watching, and we'll see you next time.